update regarding the COVID-19 pandemic and the current situation, the current risk, especially about the new vaccination program. So I don't want to go into details about the COVID-19 because we all have heard so many times about it. There's been a lot of newscasts and updates in YouTube and social media. I just want to go straight into the current situation with COVID-19. You know, it's a pandemic, it's affecting all over the world. We have almost 2 million people who have the infection in the UK, and about 60,000 deaths, which is something which we need to be very, very concerned about. The most important thing to note here is the risk groups from this virus, which is the baby population, as you know. So about 80% of those who are listening to this speech are at a very high risk of COVID-19. It is true that majority of these people, 80% of us, we will get the virus, and some of us will not even know we had the virus and pass it over, or we will have very mild symptoms like cold and cough. That's the good news. The bad news is those who get affected and severe will get really severe and die from this. So it's very, very important we don't take this lightly. I know there's a lot of conspiracy around this virus, which people say some people say it's a bioweapon, some people say it's made up political agenda, but it doesn't matter. The virus is real, it's there, and it's killing people. So the least we can do is to be aware of the virus and stop spreading of this virus. Very, very important message. The way you can stop spreading this virus are by 3 means. Number 1, use protective equipment so that you don't get the virus and you don't give it to people, like face masks, and regularly wash hands and use antibacterial wash or gels or whatever you can use, and also keep the space. It's very, very important when it comes to space that we are conscious about where we are. If you're in a larger place like in here, you need to make sure that there are spaces at least 2 meters apart. If you're using protective equipment, at least 1 meter apart. And also, if you're in a smaller place, then you need to observe the numbers. Anyway, so just going straight into the current situation. So at the moment, we are in tier 3, which means that what it indicates to you as a common person, that the infection rate is very, very high. In Harrogate, currently, the infection rate is 222 people for 10,000. So that's how severe they will get. About 222 people will get severely unwell because of COVID-19. The risk is very, very high. So the point what I'm trying to tell you is that I know we are quite fed up of all these regulations. We are quite fed up of people telling us what to do, what not to do. The Jummahs not being allowed. There are limited numbers we can get, but that's for a reason. So I want people to really be aware that the reason why these measures are there, so that we can protect our community, we can protect our vulnerable group. There's a very important message I want to send off, that there's a lot of misconception about immunity and vaccination. So starting with immunity, there's a lot of people who believe that once they have COVID-19, a lot of believe they have had it in the last 12 months and they are immune. This is nonsense. We don't know how long the immunity of COVID-19 lasts, that the COVID vaccine lasts, and how effective it is, and whether it can be really effective. Just to be very, very clear about this, I have a colleague who is a doctor who is very fit and well. He does not have any long-term conditions. He's in his late 50s. He had COVID-19 somewhere in March. It was confirmed in the hospital. These are not the commercial test kits. He was in the hospital, he was confirmed. Within 3 months, he had another episode of COVID-19, which was worse. He was admitted to Barnet Hospital. He was there for 6 weeks in the ITU and another 2 weeks in the non-respiratory ward before he was discharged. Even he doesn't have a guarantee that he will have COVID-19 again. So let's think, brothers and sisters. This is a significant risk for our community and our vulnerable people, and let's not take it lightly. I can speak to any of you individually if you've got any concerns from the family perspective. It doesn't matter, one person is affected, 10 people affected in our family. You're not protected from this virus. The virus have two ways of resisting. Number one is changing itself, and number two is changing itself in terms of infectivity, and changing itself in terms of resisting your own immunity. That's how the viruses work. It either spreads very quickly and it gives off the infection to majority of people in a community or in a society, and or it actually resists immune response. I'm talking about our autonomic immune response, which is in our body, acquired immune response, which the body learned from an infection, or immune response from the vaccine itself. The vaccine is directed towards producing more immunity against the virus. There are different types of vaccines. At the moment, the one which is rolled out is from Pfizer and Antech. We have got secured about 40 million vaccines, out of which only 20 million people can be immunized, because you need 2 doses, 21 days to 28 days apart. It's very, very important we get this virus. You know it's not your choice. You'll be chosen according to the risk criteria. The first group who is going to be vaccinated is 8 years and over, care workers and clinical colleagues like NHS workers. The second group will be over 75, then over 70s, and then over 70 and high-risk group, then over 65s, over 60s, 55, 50s, and then anybody over 16 years of age. This vaccine is not for children under 16. The point I'm trying to make is the vaccines there is being checked. The efficiency is very good. There are 3 leading vaccines now in the world. So only one's being kind of authorized to be used in the UK at the moment. That's the one with the Pfizer and BioNTech. It's a German and Belgium-based company, and it is as effective as you can have a viral vaccine in its early stages. There have been a lot of concerns about these vaccines. We haven't given enough time for it to be trialed out, so they are not safe. There's a lot of rumors about it. This is not true. Yes, if you can trial out a vaccine for 10 years before you give it to patients, that's much more safer than you trial out a vaccine for 1 year. But all those trials have got certain set steps they have to pass before they can be allowed to be injected in the human being. But these steps are not taken away from the trials. We say, for example, there are 5 steps you need to do. Then these steps are not taken away from the trials, still there. These are safety regulations. What they have done is, instead of they are doing 1 step, finish it, do the 2nd step, finish it, do the 3rd step. The only thing what they have done is they have overlapped those steps. So they put a group of people for this research, we say 10,000 people, going into 1 step. So you don't wait until 6 months or a year for that step to finish. They start them on the 2nd step while they are on the first observation. And while they go on for a while on the 2nd step, they move whoever positives with results into the 3rd step. At any point, when somebody is on the 3rd step, they'll identify a failure from the first step, they will take them away totally, or they will stop the stuff totally. That means it's a very high risk to the pharmaceutical companies or the labs, but if it works, it actually gives you a rapid report, and that's what has happened. So there's no corner cutting as per se, but there is more multiple parallel processes they follow in terms of approving this vaccine or getting the vaccine out to be injected into the population. So it's a very important myth where we need to really get rid of, that these vaccines are not safe. Within the safety margins, it's most of the medical professionals and researchers who went as guinea pigs for this vaccine, they have not shown any significant side effects at all whatsoever. So the message I want to give out is the disease is real. If the vaccine is offered to you, please take it. I'm having my vaccine next Tuesday, and I want to recommend to anybody who would be able to get this vaccine to get the vaccine. You'll need 2 doses from the first vaccine, which is Pfizer and BioNTech, one, and then after 21 to 28 days you have the second dose to get the best outcome out of the vaccine. The last thing I want to stress here is the measures we take reflects on the precautions a community will take so that we can stop the virus. It's very important. Ideally, we should all be vaccinated, we should all develop immunity, and hopefully that will push the disease severity out of the population. There will still be some people who get very unwell, there will still be some people who will die from this disease, but the severity, majority of these people who get infected will go down, and the numbers of death will significantly go down dependent on how soon we treat them. So the last thing I want to say before I finish is please be considerate toward the community, please be aware the disease is still there and it's real, and it is there among us. In this area, Haringey and Barnet is a very high severity area, so beware. And the third thing is, don't listen to the myths of the vaccine. Yes, it hasn't been in the market for too long, but it is the safest thing we have. What would you rather do? Risk and get infected and risk the chance of dying, or take the risk of taking the vaccine, and even if there are milder side effects, we will deal with those side effects. The important thing is the balance between the pros and cons. So far, the three vaccines, which is the Oxford one, the one which is out now, which is the BioNTech one, Pfizer one, and also the Moderna one, all these three are very efficient. They work very differently, but they are very efficient in terms of reducing the risk of severe COVID-19. You might still be able to get COVID-19 because none of the vaccine is 100% efficient, but it's very important that we get ourselves immunized so that we can reduce the spread to our loved ones and our community. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
To wonderful Dr. Feroz, the GP.